I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Herbal medicine has been practiced for thousands of years. Before drugstores, there were herb gardens with roots and remedies. This is the People's Pharmacy with Terry and Joe Graydon.
You might be surprised to learn that animals use medicinal plants from their environment. How do they pass their healing knowledge along without language?
Have you ever wondered about creating an herb garden at home? All you need is a window box or a planter and a bit of sun and soil.
Both thyme and mint are easy to grow and have wonderful medicinal properties.
Coming up on the People's Pharmacy, the practice and philosophy of herbal medicine.
In the People's Pharmacy Health Headlines, the Food and Drug Administration has announced that a common ingredient found in many over-the-counter cold medicines is on the way out. The FDA has finally determined that phenylephrine is not effective as an oral decongestant. This decision comes after decades of evidence that this medication is not well absorbed from the digestive tract. That's because it's metabolized in the gut and in the liver. Not enough gets into the bloodstream to produce a decongestant effect. Hundreds of products will have to be removed or reformulated if the FDA actually carries through on its findings. In the meantime, though, companies can continue to sell cough, cold, and allergy remedies with phenylephrine.
Ever since the beginning of the 21st century, Americans have had to rely on drugs made abroad. The United States Pharmacopoeia recently completed a medicine supply map. It shows that only 4% of the active ingredients in our medications come from U.S. manufacturing facilities. About half are made in India, and a third are created in China. According to the report, China has dramatically increased its pharmaceutical manufacturing capacity. Active pharmaceutical ingredients known as APIs are also much less likely to come from Europe. In 2000, 42% of APIs originated in Europe, while in 2023 only 10% did. Relying more heavily on pharmaceuticals from abroad could exacerbate the ongoing problems with drug shortages.
Nighttime leg cramps can wake a person from sleep with excruciating pain. Although they're common, physicians have little to offer a patient who suffers from them frequently. The FDA has not approved any medications to treat leg cramps and has specifically forbidden doctors from prescribing one old-fashioned treatment, quinine. Now, a placebo-controlled trial of nearly 200 volunteers found that a supplement, vitamin K2, reduced the frequency, intensity, and duration of nighttime leg cramps. People taking the placebo did not experience any change in their nighttime cramps. According to the study published in JAMA Internal Medicine, the difference was significant, with no adverse side effects. People taking the anticoagulant warfarin do need to avoid sudden changes in their vitamin K intake.
Vitamin D deficiency has been associated with sleep apnea in adults. A study published in JAMA Otolaryngology Head and Neck Surgery has now found that vitamin D deficiency may be common in children who have breathing difficulties at night. The study included 72 youngsters undergoing tonsillectomy to address their sleep apnea. More than a third of these kids were deficient in vitamin D, with lower levels associated with greater breathing problems. We don't know if vitamin D supplementation can reverse this difficulty.
One of the biggest challenges for people caring for patients with dementia is a collection of symptoms categorized as agitation. People with Alzheimer's disease, Lewy body, and vascular dementia often suffer from anxiety, excitation, irritability, and insomnia. At a recent meeting of the Clinical Trials on Alzheimer's Disease conference in Madrid, Spain, researchers reported that cannabis could be helpful. These investigators performed a small placebo-controlled trial using nabilone, a synthetic cannabinoid medication. The FDA has approved this oral capsule for treating the nausea and vomiting associated with cancer chemotherapy. The new study demonstrated that nabilone could reduce aggression and agitation.
Irritable bowel syndrome, or IBS, is often characterized by severe symptoms of diarrhea. It can be disruptive and hard to treat. A new study published in the journal Nutrients suggests that an extract of pomegranate peel might be surprisingly helpful. The researchers treated rats to produce a condition comparable to IBS. Treating the distressed animals with pomegranate peel extract reduced their symptoms, calmed intestinal inflammation, and improved intestinal barrier function. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Today, we'll be talking about growing and using herbs at home.
We're delighted to be talking with the People's Pharmacy herb expert, Dr. Tieraona Low Dog. She's a founding member of the American Board of Physician Specialties, the American Board of Integrative Medicine, and the Academy of Women's Health. Her books include Life is Your Best Medicine, Fortify Your Life, Your Guide to Vitamins, Minerals, and More, and her latest, Healing Heartburn Naturally.
Welcome back to the People's Pharmacy, Dr. Tieraona Low Dog.
Thank you. It's so good to be with you.
Dr. Low Dog, we are talking today about one of your favorite topics. I know that people come from all over the place to your medicine ranch in order to learn how to grow herbs, a variety of different ones. And that's sort of what we want to talk about today, because I know, people buy things at the health food store and at the pharmacy these days, but sometimes they say, I just like to grow some time at home. So I wonder if you can tell us, in a kind of a general way, the most cost-effective way to keep families healthy. If you can make spaghetti, you can make herbs. I think you've said something to that extent, and I'm wondering if you can just help introduce our listeners to the idea of herbal medicine making.
Sure. What a wonderful topic, too. I think that it wasn't that long ago that everybody had a small garden, a small plot outside of their home, and people were growing, their pot herbs, things that they would cook with, because it's been relatively recent that people have relied primarily on salt and pepper for their seasoning, right? So we've long used the culinary herbs both for cooking as well as for medicine. So the thyme that you use at Thanksgiving is also a wonderful herb for coughs and colds and for indigestion, right? So that thyme that you could grow, that you could just get, you can buy organic thyme, at most garden centers now. They're organic. They've already got them started for you. They're very easy for you to take home and put into a pot. And then you can trim it and use it throughout the season. And if you keep it inside, you bring it inside, then you can have it, year round. You can always have thyme available for yourself. Sage is another one, right? So there's so many of these culinary herbs that have these amazing medicinal benefits, as well as being able to be used as food. Hippocrates said, let their food be thy medicine and thy medicine be thy food. And you have to remember that in that part of the world, in the Mediterranean, that culinary herbs were just, people use them all the time. When we talk about the Mediterranean diet, I find it fascinating. People are always talking about the fat or the seafood, but they forget how much garlic and how much onion and oregano and basil and just the number of spices and herbs that are included in those dishes. I think they contribute immensely to the health benefits of that type of diet. So
Absolutely.
So when you're thinking of growing some of your own herbs, I would just encourage you to start small and start with things that you think you would enjoy, right? So, you know, going to the local garden center, looking for their organic area. You do want to, especially if you're going to be making medicines, but also if you're adding them to your food, you'd like them to be organic when possible. Or just grow your own. I grow all of my own herbs and spices. You get the seeds and just grow them organically at your home. But start with things that are easy for you to begin to use, like peppermint. Peppermint grows great in pots. Please don't grow it out in your main garden because it'll just take over the place. But peppermint in a nice big pot looks lovely, smells great, and you can just pick leaves off and make yourself a nice tea whenever you want, right? But that peppermint, you can also make a nice strong tea of that, and you can put it in an ice cube tray, make ice cubes from it, and then in the heat of the summer when you're looking for something that's cooling, you can just take your peppermint ice cubes out, and you can put them in your glass of water, and you get this nice, refreshing drink that tastes so good. But those peppermint ice cubes can also be used, and you can put some in a little bowl of water, and you can put a washcloth in there, and you can use that on bug bites. You can use that for a child with a fever. You can use that for sinus congestion because peppermint is very soothing because of the menthol, very, very soothing to the tissues, whether it's hot or inflamed from like a burn or a bug bite or a fever. So what I'm trying to say is there's a lot of ways to get started, but start with things that feel familiar. Start with things that are easy to find in your area, and that's a good place to begin. And from there, there's so many directions you can take it.
Well, you've just described a couple of things that can be made with just hot water and the leaves. Are there special materials that we need for making herbal medicines at home?
So we just described an infusion. So that's the name that we call, or a tisane if it's an herbal tea, right? Versus tea, which is from black or green or oolong tea. So these are the oldest and simplest ways to use an herbal medicine outside of just eating the plant. And all you really need is good, clean water. So a lot of books will tell you to use distilled water. You know, I think as long as you have clean filtered water, you can use whatever you have at your home. And you need to have something to heat the water in, and then a heat-resistant cup and a lid, because you're going to steep your tea. You're going to steep the tisane. You're going to steep the herbs. And generally, when we're making a medicinal tea, we steep it longer than a conventional sort of just beverage type of herbal tea or even a green or black tea. So when you make, for instance, your thyme tea, you're going to let that steep about 10 minutes, right? So it's going to be quite a bit longer than you would say just your morning breakfast tea or your morning breakfast black tea, which is 3 minutes. So you're going to steep it with a cover, and then you'll strain it. So you need a strainer, something to be able to strain the herbs with. And then that's it. You can always add honey or lemon to your teas or sugar if you prefer, but honey goes nicely with many of these. And that's all you really need, something to heat the water, good, clean, filtered water, your herb, a cup, and a strainer, and you're good to go for making your herbal infusion. A decoction is an herb that is simmered, right? So this is what we use when we're going to make an herbal medicine using a root or a bark or a hard part of the plant, right? So we were talking about peppermint leaf. Well, say we were going to use something like echinacea root, and we were going to make an medicinal herbal preparation from that. That would be, you'd have to simmer it. So we call that a decoction. So you would then take a pan and you would put your herb into the room temperature water, and then you'd bring that to a boil, turn down the heat, put a lid on it, and simmer it generally for 7 to 10 minutes. Take it off the heat and strain it. You have to simmer or expose the roots and barks to a higher temperature to be able to release the medicinal compounds that are found within that plant to get it out into the water. So soft parts of the plant are steeped, like leaves and gentle flowers, or there's a few exceptions, but those in general, that's the truth. And then for roots and barks or harder parts of the plant, those are simmered at a higher temperature.
I want to go back to peppermint for just a sec because we actually have peppermint taking over everything. So you're right. Be very careful about planting peppermint in your backyard.
We did not plant it. It was
It was
there
it
when
was
we got there.
and it continues to grow. But here's my question. Ice cubes. Now, are you like putting a bunch of peppermint leaves in the ice cube tray, or how do you get those peppermint ice cubes? Because that sounds delicious, but I don't know how you do it.
You just make your tea, make your nice batch of tea the way we just talked about, making a nice strong peppermint tea, steeping it for 7 to 10 minutes. Then you strain it out, let it cool a bit, then put it in your ice cube tray and put it in the freezer. I actually, when we're going to have guests over or when I'm just wanting to do something for the family, I not only put the peppermint in the ice cube trays, but I'll put like a raspberry, because we have a lot of raspberry bushes. I'll put a raspberry into each one of those ice cube slots so that when we take them out and put them in the water, there's this beautiful greenish colored ice cube with this beautiful raspberry in it, which then melts into the water. It's not only incredibly refreshing, but it also looks very beautiful. So another way, because sometimes water just gets boring for people. And peppermint, for many of us, that's also nice because it helps aid our digestion. It's good for the tummy. And because it's a cooling herb in the heat of the summer, it actually helps you feel cooler when you drink it.
Well, it's cooling because menthol activates TRPM8.
That's right.
So we keep getting excited about the transient receptor potential channels.
Yes, which is one of the things that when you apply it topically, when we found the menthol receptor, right? Because people have noted the cooling effects of peppermint for thousands of years before anybody ever knew there was a receptor for it. When you apply it topically, it has a very cooling effect on the skin. It has it also internally, but many of your rubs that your listeners may use for like a muscle ache or things like this have menthol in them, and it makes this cooling type of gel that can help relieve minor aches and pains. Peppermint is just an amazing plant, and it's so easy to grow, and it just comes back every year. I have them in pots. I trim them back at the end of the year, take whatever's left and dry it so that I have it all winter. And then the pot just comes back in the spring, and I've got my peppermint all ready for the next year. So you invest, what, $3, $4 for your seeds or $5, $6 for your plants. And if you take care of your peppermint, you'll never have to buy peppermint ever again.
You're listening to Dr. Tieraona Low Dog, founding member of the American Board of Physician Specialties, American Board of Integrative Medicine, and the Academy of Women's Health. She was elected chair of the U.S. Pharmacopoeia Dietary Supplements and Botanicals Expert Committee. Her books include Fortify Your Life, Your Guide to Vitamins, Minerals, and More, and Healing Heartburn Naturally.
After the break, Dr. Low Dog describes how her travel abroad has changed her practice of herbal medicine.
In some places, cacao is used as an effective cough remedy.
Many primates seem to practice their own type of herbal medicine.
You'll also hear about the medicine bear. You're listening to The People's Pharmacy with Joe and Terry Graydon.
This episode of The People's Pharmacy is supported in part by Gaia Herbs, crafting the finest herbal supplements on earth since 1987 at the Regenerative Organic Certified Farm in Western North Carolina.
Check out their new website and explore how Gaia Herbs sets the standard for high-quality, ethically sourced herbal supplements. Discover the finest herbal supplements on earth at www.gaiaherbs.com.
Enter our special promo code, uppercase PEOPLE, PEOPLE 15, to get a 15% discount on your order through December 31st. That's Gaia Herbs, GAIA Herbs.com Special promo code PEOPLE, PEOPLE 15 to get a 15% discount through the end of the year.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by Cocoa Via Dietary Supplements. Cocoa Via Cardio Health is offered in both convenient capsule and powder formats, with each serving containing 500 milligrams of cocoa flavanols to support heart health. More information at cocovia.com.
Today, our topic is Roots and Remedies, the practice and philosophy of herbal medicine.
Our guest is Dr. Tieraona Low Dog, one of the country's foremost experts on the science and practicality of botanical medicine. She's a medical doctor and founding member of the American Board of Physician Specialties, American Board of Integrative Medicine, and the Academy of Women's Health. Her books include Life is Your Best Medicine and Fortify Your Life, Your Guide to Vitamins, Minerals, and More. And her latest book, Healing Heartburn Naturally, a guide to managing acid reflux and restoring gut health.
Dr. Low Dog, people around the world have learned how to use what is in their environment for healing. And as we understand it, you have been to a lot of places around the world to find out what they're up to. And how has that changed your practice of herbal medicine?
I love meeting herbalists all around the world, healers all around the world. And what is so fascinating to me is it doesn't matter where I go. If I start talking to somebody about, I'm a doctor and I love herbs and I love learning about the plants for medicine, invariably people will take me. They will take me someplace to meet somebody, and somebody will take me to see somebody's grandmother, and the grandmother will introduce me to somebody over here. And that has been going on for more than 40 years. It has never failed. Wherever I travel, I have met people that are so generous with their time and their knowledge. The piece there are many parts of this that I think are powerful for me. One is the curiosity to come always when you're meeting new people and you're going to new places, come with a curious mind and a very open mind to see what people do to take care of the ailments in their own area. When we were in Uganda, we were at Bwindi, over near Bwindi Impenetrable Forest, which is just what it sounds. It's fairly impenetrable, hard to get through all the vines to walk through this area. But when I was speaking with a number of the local healers there, with a translator, somebody who was translating for us, it was fascinating not only how many herbs they had that they would use to treat things like malaria and fever, wounds, snake bites, etc., a pretty vast array, actually. And many of these plants, when I went and was looking them up, because I was not familiar with so many of them, actually, the ones that had been having some research done definitely have powerful alkaloids or glycosides or compounds in them that could actually verify that there would be a biological explanation for why these would be working in the way that these traditional healers were saying that they did. The other fascinating thing at Bwindi was one of the healers was talking to us about how much they had learned about the plants from the gorillas that inhabit that area, and that many of the plants they learned from the gorillas using them and watching and observing them. So that fascinated me. When I came back, I reached out to a number of folks to sort of find out if anybody could help direct me in that area. I was curious, have people studied what gorillas consume? And actually a lot of data has been collected on that. And I don't remember just how many of the herbs that gorillas used are employed by the locals, but it was something like north of 70%. That also intrigued me because one of the things I've often wondered is, how did we come to learn about how we use these medicines? Was it all trial and error? Was it observation? did we observe things like monkeys or gorillas being able, in that environment, be able to use them when they were sick or for wellness or health? A number of these plants that people use, actually, they have observed chimps or gorillas using to prevent parasitic infections, and they're highly effective for that. And the people use them in the same way. So I just, and then Costa Rica is just an amazing place, as is Mexico. Mexico, one of the most biodiverse regions in the world. People just don't think of it in that way. But going into Mexico, it was the first time I'd ever really seen wild yam. These huge, massive types of roots on this plant. And I know Joe would probably know this, but about 50% of our steroid drugs were originally made from the diasgenin that came from this root, from this plant. And just talking to the local people about how they use wild yam, especially for gut problems, and for really painful intestinal cramping. And I just was fascinated by this. Costa Rica, the same thing, being able to literally, have a cacao ceremony. I went and it was just a few of us. It wasn't a touristy thing. It was just with a local person, a local ethnobotanist, and he made us a traditional cacao drink. So with no sugar or anything like this in it, not like a milk chocolate, but true cacao. I was with my husband and we were drinking it, and he looked over to me and he goes, "Wow, is this supposed to make me feel strange?" And I said, "Well, how do you feel, honey?" He goes, I don't know. And it was amazing that when you took this cacao drink and you made it in this very traditional way, it felt a little intoxicating, not like alcohol, but it definitely had this very pleasant and relaxing and sort of heightened awareness. It was this interesting sort of effect that we had. And I realized I'd never had cacao. I've always had chocolate. And I realized then why people called this food of the gods, long before they put sugar in it, because of its amazing therapeutic effects. Cacao is one of the strongest cough remedies that we know of. It's equivalent about to codeine, I think it's superior, as a cough suppressant, something you can just remember with dark chocolate. If you're out and about and you get one of those dry coughing fits that just, every time you start to speak, you can't speak, you start coughing, just suck on a little dark chocolate. I did this speaking before 1,000 people up in Chicago. I asked if anybody had any dark chocolate because I was coughing so hard. And about 50 women in the audience all raised their hands. It was kind of funny. But I said, if anybody has a dark piece, I'd appreciate it. A woman ran up and she gave it to me, and I turned around and just kind of sucked on it for maybe a minute or two, and then chewed the rest and swallowed it. And I finished the rest of my talk. And people were stunned. They were like, wow, I learned that. I learned that many, many years ago when I was in Costa Rica.
Well, Dr. Low Dog, speaking of Costa Rica, when we first came to Durham, North Carolina, Terry was teaching in the School of Nursing and in the Department of Anthropology at Duke University, and we met Dr. Ken Glander, who was an anthropologist as well, and he did a lot of research in Costa Rica with howler monkeys. And he pointed out that at certain times of the year, they will eat certain kinds of leaves when they have a very heavy parasite load. And he said, we've analyzed these leaves and they have anti-parasite activity. And I got to thinking, that's so incredible because they don't eat the leaves all year round. They don't have a lot of nutritional value, but they do help get over a parasite infection that's causing symptoms. And I thought, how in the world do howler monkeys communicate to each other from one generation to another that at certain times of the year, these plants can be helpful? And I thought back to what you were talking about, the chimpanzees.
Gorillas.
And the gorillas. And how many animals have learned from experience, and not just years, but decades and centuries, which plants to consume and which plants to avoid. It's just so fascinating.
It's so fascinating. And, I think it's why I love being like an amateur naturalist, right? Because I'm so fascinated by nature. You could spend your entire life just in one ecosystem and be the richer for it. And when you die, still not understand it completely. And that keen observation that I think people had, that in some ways I feel we lose when I'm talking to young medical students, I mean young in their careers and young doctors. I'm often, they're so quick to go to the lab. They're so quick to order labs. And I'm like, did you do a good physical exam? And they're like, well, yeah, they listen to the heart, listen to the lungs. I'm like, but there's so much that the body can tell you if you're just observing, if you're watching, if you're examining. So I do think that the power of observation in some ways is being lost as we become more and more removed from firsthand experience, and we're beginning to rely more and more upon technology. So just a side observation, perhaps.
Well, Dr. Low Dog, one of the things that's so fascinating about learning what non-human primates do is the idea that they've been able to pass along to their group members the knowledge about which leaves, which trees, which roots, which berries, what have you, to consume or to rub on their skin at various points to take care of problems. And there's not a huge amount of research on this, but there's enough to say they really are being quite intentional. And how do they transmit that knowledge? They don't have language. They don't have stories. They don't have legends like we humans do. And that brings me to ask you about the stories of the medicine bear. Could you share that, please?
Sure. The bear is a powerful totem or a powerful animal to many indigenous peoples wherever bear live around the world. And bear medicine is considered to be very powerful, both the bear, its actual self as an animal, but also it is believed by many, many peoples that the bear brings the medicine to the people, that helps to teach the people about the medicine itself. Bears are interesting from perspective that they go into torpor, not a true hibernation, but they go into torpor for many months when they eat a lot of food, and then they go in and they go into this deep, deep state of sleep and relaxation. And they recycle their urine so that they don't need to drink. Females will have their babies and nurse them and care for them until they re-enter into they leave their protected den in the spring. And in the spring, it's interesting the types of plants that they consume, the grasses, the leaves, the berries that they consume. All of these, when you look at it, and it depends upon the environment, but in our area here, the grasses that they consume, but all of the berries, all of the juniper berries that they're consuming huge quantities of these. In the fall, they're consuming huge quantities of the acorns. And people, when you actually start looking at like juniper berries and what they do, people actually would used to use dandelions and other kinds of spring greens as a detoxification kinds of teas. They would also consume juniper berries. They would eat small amounts of them as a diuretic to kind of flush the system out after they'd been sort of inside during the long, cold, dark winter months. Isn't it interesting that the bear are doing exactly the same thing? And you wonder if there was observation from long ago where people began to think of spring greens and spring tonics after watching bears emerge from this long, deep hibernation. The bear itself, though, is a very powerful animal, and one that is considered to be a very strong medicine animal for many people around the world. it is why the bear is on our Medicine Lodge logo for our ranch. We have an average of 13 to 15 bears that call this area where we live home, and we've learned a lot about them over the time that we've lived here. Very powerful animals. And again, how do they teach? I think these, a bird knows how to sing its mother's song, even if it's separated early. There's a lot of things that are inherited types of knowledge that are passed down. And the chimpanzees, they're such social creatures. I was thinking earlier we were talking about the howler monkeys. I know the chimps do exactly the same thing. They take this aspilia, this beautiful yellow flower, and it's got these really hairy leaves. And you can watch, they'll take, they'll use their lips and they'll take one leaf and they'll kind of, fold it up and they'll put it into their mouth and they'll swallow it whole. They don't chew it. This has been observed, multiple times. And it contains this really powerful anti-parasitic compound that can kill parasitic nematodes. And the humans in that area over near Kabale, where these chimps were, use them exactly the same way. I mean, so think about it. So a little bit like what you were talking about, they only use it during particular times. And the gorillas are interesting because the gorillas, they have a different kind of gut than the chimps do, and they're better able to detoxify harmful compounds on their own. So they don't tend to have to self-medicate as much as chimps and humans do. So I said, just fascinating. And even when we were down in South America and you looked at the macaws, the red and green, those beautiful macaws, they go over and they eat, fairly significant amounts of clay to kill bacteria. So they're using the clay in a similar way internally to do this. And in Kenya, when we were in Kenya, where the beautiful elephants are, the pregnant elephants eat the leaves of this Berkia tree. They eat the bark off of it, actually, not the leaves, the bark. And they do this when they're getting ready to give birth. And they use this to stimulate labor. And the women in the villages use the bark in exactly the same way.
Wow.
So fascinating. It's fascinating. And so for me, going and learning about the plants from the people, but also from the people, how they've learned about many of them from the animals, it's just such a powerful connection for me that reminds us how connected we all are and how connected we are to the plants, and that we've relied upon the plants for our food, for our medicine, for our shelter, for our entire existence. And it's not just us. The animals rely upon them for their food and their medicine as well.
You're listening to Dr. Tieraona Low Dog. Her books include Women's Health in Complementary and Integrative Medicine, Life is Your Best Medicine, Fortify Your Life, Your Guide to Vitamins, Minerals, and More, and Healing Heartburn Naturally.
It's time for a short break, but after that, we'll talk about wound care.
What do animals and people do to take care of injuries?
Dr. Low Dog talks about the medicine road. What does that mean? Where did modern medicine go wrong?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is made possible in part by CocoVia, backed by 20 years of scientific research and the maker of the most proven and concentrated flavanol extract in the market today, Coco Pro Cocoa Extract. Cocoa flavanols are among the most studied plant-based bioactives today and are clinically proven to promote cardiovascular and brain health for the long term, supporting a strong heart and better memory.
Get 15% off your order of any CocoVia product by using the discount code PPOD15. Learn more at CocoVia, and remember that discount code is PPOD15. OD 15.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. Cocoflavanol supplements that support cognitive and cardiovascular health, made with a proven concentrated flavanol extract. More information at cocovia.com.
When we think about herbal remedies, we might imagine grandmothers around the world passing their knowledge on to family members. Sometimes that has to do with herbal teas or poultices to treat wounds. But do animals also have knowledge that they pass down from one generation to the next?
We're talking with Dr. Tieraona Low Dog. She was elected chair of the U.S. Pharmacopoeia Dietary Supplements Botanicals Expert Committee and was appointed to the Scientific Advisory Council for the National Center for Complementary and Alternative Medicine. Her books include Women's Health in Complementary and Integrative Medicine, Life is Your Best Medicine, Fortify Your Life, Your Guide to Vitamins, Minerals, and More, and Healing Heartburn Naturally.
Dr. Low Dog, you've been talking about how we can learn from the animals, and you've mentioned parasites and leaves, but the thing that fascinates me is that when you're living in the jungle or when you're a farmer living on the plains, one of the most common problems you're going to run into will be a wound. You're going to cut yourself. You're going to scratch yourself. Your skin is going to be abraded in some way or another. And if you think about what modern medicine has, well, we have antibiotic creams and lotions and ointments like neomycin or polysporin. And then we slap a Band-Aid on. But they don't really help with healing. They hopefully prevent infection. But I'm just curious if over the years and the places that you've been, if you've learned anything about what animals or people have used in the way of natural healing when it comes to skin issues.
Well, I think that herbal medicine actually excels in wound care because so many people died of wounds, right? I mean, it was, you got a severe injury, especially in, warfare and in ancient times. It took many people's lives, and there were entire stories built around herbs that could heal. Yarrow is one of the classical herbs, and wherever I go where yarrow grows, people use it for a similar purpose. Yarrow, Achillea millefolium, or Achillea from Achilles, because the story goes that when Achilles, the warrior, was going to retrieve Helen of Troy from King Priam, he went to Chiron, the centaur that was the healer. And the healer Chiron told him to take this plant into battle and to apply it to any wounds to prevent infection, but also to stop bleeding, to staunch the flow of bleeding. Yarrow was used all the way through the Civil War in the United States as standard soldiers' issue to apply to wounds to stop the flow of bleeding and also help reduce the risk of infection. So this is a plant for more than several thousand years people were using. And the story, and I think it was older than that, but the story itself helps people remember how to use it, right? Soldiers' woundwort was what yarrow was known throughout Europe for. So I love yarrow. I love yarrow. I love compresses made of yarrow, especially for road rash and things like that. Once you clean it well to help heal. I love calendulas and plantain, the common plantain, not the banana, but the plant. The plantain plantago is also used extensively for this. But wherever I go, here out on the Navajo reservation, they use the dock. They take the dock leaves and they pound them and mix them with water. And those are applied especially not only to humans, but to animals where there's wounds on the animals. And let me just also say our horse, Kohana, took a terrible cut on her foreleg during one of our classes here at Medicine Lodge. And so Jim came and got me and said, "Do you think we should call the vet?" Because it was pretty deep. I grabbed some sage that I had made, that I had steeped in a local honey, and it had been steeping for about a month. And I took that honey up, strained the sage out, and took the honey up, and I packed the wound with it, and then wrapped that with gauze, and then put duct tape on it, yes, because it's a horse, and she was going to rip it off. And after cleaning it, and I changed it every day for, I don't know, a week, 8 days. And after a few weeks, I mean, the healing was so pronounced, but when you see her now, you can barely see that she had a scar. This was a very deep and dirty wound that she'd got that required a tremendous amount of cleaning. And then the sage within the honey kept the infection from forming and also promoted healing and granulation of the tissue in a remarkable way. Honey has long been used for wounds, wound care, and burns, still is being used for that. Many people are familiar with Manuka honey. And sage is a powerful antibacterial that also has been used internally for colds, coughs, digestion, and topically for wounds. So I would say that, wherever I go, people have their local plants. There are many. When we were in Kenya, I mean, there must have been 50 plants they showed us that are used topically for wounds. So very, very common. This is and it's still common knowledge in many parts of the world where there's limited access to a clinic or a doctor, and people have to deal with minor wounds all the time.
Dr. Low Dog, I'd like to switch gears just a bit right now. We're still going to be talking about herbs, I think, but I'd like to ask you about the concept of the medicine road. As I understand it, you have said your path through life is your medicine road. Can you explain what you mean, please?
So that really was my grandmother. When I was very young, my grandmother would take me to Medicine Lodge, Kansas, to the powwows there. Had a very special place in her heart. It's where the Comanches had surrendered to the military, and the powwows are held there. And I went with her, and it was the first time I'd ever been lost in the drum. So there was just the drumming and the singing. And when I say lost, I really mean that. I mean that I kind of lost time, and my grandmother sort of roused me, and it felt like I'd been in a dream almost. The power of drumming, I really experienced that in that moment at a young age. We were driving home, and she was kind of in a thoughtful place, and she was saying to me, she said, "Honey, when you were born, you were put on a path." And she said, everything you do in your life, the way you eat, the way you treat people, the things you say to others, but also the things you say to yourself, that's medicine. That's your medicine. Yeah, and you're on your medicine road. I was a little kid. I didn't fully understand what she was talking about. As I got older, I began to understand more what she meant. And it's probably what drew me into, midwifery and herbal medicine, and later into medicine to become a medical doctor and then an integrative physician, was this concept that everything we do in our life affects us. And if medicine is something more than just a pill or a surgery, if medicine in a bigger concept is our life, it affects us in a good way or in a more harmful way, then it's important to think about how we're walking on that road. And for me, it's been a guiding principle. And I feel very blessed. I think my grandmother was a wonderful teacher, and I think she planted those seeds. Her mother was a midwife. When she would give us herbs as kids, I never thought it was something unusual. I thought everybody's grandmother gave them herbs, when they were sick or not feeling well. And going out and gathering the herbs with her, and in the fields, and when we would go to Minnesota gathering herbs. This medicine road is powerful, and I think today we call it things like lifestyle medicine. I think mind-body medicine. These are the words we use for what people have long described and known, that it is the way that we live our life that determines the quality and the joy in our life.
You know, Dr. Low Dog, I think everybody who hears your words just resonates with what you are saying. And I wonder where modern medicine went wrong. And you are a medical doctor, and so you know that system really well. But we have become very reductionist in our thinking. I mean, as someone who really focused on neuropharmacology in my career, we were trying to get down to the individual neurons and the individual neurotransmitters, and we weren't thinking very much about the whole body system. And so, when you talk about your medicine road and the food you eat and the company you keep and the thoughts that you think and your relationship with others and with yourself, it's such a bigger picture. It's so much more profound. How can we help your colleagues, your medical doctors who you interact with and who are, following their own path, get back to the medicine road that you're talking about, which is really fundamental in the healing process? And that goes for nurse practitioners as well as physician associates and pharmacists and all the other healthcare workers out there.
Well, I think the first thing is to rejoice for the reductionism, to embrace the wonders that it has brought, the new novel treatments and the new approaches that we have that have saved so many lives. So to feel so good about the work that has been done and to remember it's not the whole picture, that it's a small piece of a tapestry that is this person's life. And that I think for many doctors, they miss this in themselves, that they long also to feel this. There's a lot of emotional and spiritual distress that can happen as a physician with seeing the suffering and seeing the sickness and seeing that day in, day out. We saw a lot of this during COVID. And part of the way that we can help ourselves and help our patients is to remember to pause before we go in and to, in whatever way we think, a prayer, a mantra, just a statement, let me be the doctor that this person needs me to be in this moment. I had a woman a number of months ago who had come in to see me, and she, was there for an integrative consult and was about her nutrition, and she had all this, but I noticed that she'd had a son who had died. And she didn't mention anything about it. And then I said, I see that you lost a son 2 years ago, and I said, can you tell me anything about that? And she became very emotional, and she began to cry, and her son had been killed by a drunk driver here in New Mexico. And she had a lot of anger and a lot of sadness and a lot of pain around that. And then she said, I'm having a hard time moving on. And so we spent about 10 minutes talking about that. And then I said to her that maybe I thought what she needed at the moment was, we needed to move with that. I wondered if she'd be open to any sort of ceremony or ritual. If, was there anything she'd done with her church, or was there any kind of ritual we could do together? And that I said, I thought that all the nutrition and the exercise, all those kinds of things we could focus on. But at the moment, I thought that her heart was still breaking. That's what I mean. If you're just showing up and looking for symptoms and you've got your prescription pad out and you're trying to do that in 10 minutes, you're going to miss the nuances. You're going to miss the pieces that the person's body is trying to tell you and what the person's story is. And so my first thing, though, with my colleagues is to make sure that they rejoice in their training and they rejoice in what they've learned and remember that it's a small part of a much bigger whole. Yeah.
Thank you so much for sharing that story, because I think that we too often forget the fact that as humans, we are also spiritual beings, and we tend to downplay that in our modern settings.
Oh, that spirit, that part of us that gives us our meaning and purpose, right? I mean, that's spirituality. It's how we find meaning and purpose in our lives. And, you know, and for me, it's a fundamental part of any conversation that I have with a patient, with a person. I had to go get a scan the other day. I had my own scan that I was getting, and the woman there, they were about an hour and a half late, and she's so frazzled. And she comes, I gave her a hug, and I said, "It's so good to see you." And I asked her, I saw a picture. I said, "Is that your child?" And she goes, "Yes, I have a son and daughter." And then we visited, and her husband died 6 years ago, and we just spent a little time. And when I left, she gave me this big hug, and she said, "Just thank you. That was so nice being with you." We have the potential in every moment, in every interaction, to listen to people's stories and to open our heart to them. And I think that is the healer that lies within each of us. I think every one of us is a healer, and we have that ability to help heal others as we heal ourselves. And then it's one of the greatest gifts, I think, of being a human being.
Dr. Low Dog, can you tell us about the programs that you are offering through your Medicine Lodge Ranch?
Of course. We love to have people come out here during the summer. It's kind of like an adult summer camp for people. This year we're doing a class on honoring spirit. We're doing it on summer solstice. It's kind of a beautiful gathering. We're doing a big 3-day herbal medicine making course. We're doing a course on herbs in the mind, taking a more expansive approach to thinking about non-intoxicating. We'll talk a little bit about, some of the, mushrooms and things like that, but we're talking about a lot of the herbs that actually can help with focus and cognition and mood and help us sleep better. And the last one is the art of formulation and prescribing herbs. So a more in-depth kind of class. And I do want to let your listeners know that at the drlowdog.com, they can find both the links to our classes, but also drlowdog.com, we have a free herbal medicine making class. It's just a totally free little short course that we did on making teas and decoctions and a syrup. And that your listeners, we would encourage them, if they're interested in herbal medicine making, that's just kind of a fun, free little place that we filmed over in Medicine Lodge that we hope people would enjoy and share with others.
Dr. Tieraona Low Dog, thank you so much for talking with us on the People's Pharmacy today.
Many blessings. Thank you.
You've been listening to Dr. Tieraona Low Dog. She's a founding member of the American Board of Physician Specialties, American Board of Integrative Medicine, and the Academy of Women's Health. Her books include Fortify Your Life, Your Guide to Vitamins, Minerals, and More, and Healing Heartburn Naturally. You'll find a link to her website on the show notes for today's show on our website.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
The People's Pharmacy is made possible in part by Cocoa Via Dietary Supplements. Cocoa Via Memory Plus is formulated with 750 milligrams of cocoflavanols, a level clinically proven to improve 3 different types of memory and support brain function. More information at cocovia.com.
Today's show is number 1408. You can find it online at peoplespharmacy.com, and that's where you can share your comments about today's interview. You can also reach us through email, radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider, including YouTube Music. You'll find the podcast on our website on Monday morning.
At peoplespharmacy.com, you could sign up for our free online newsletter and get information about our weekly podcast.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.